Story 1. My sister went to a gynecologist because she had been experiencing breakthrough bleeding for several months, along with very heavy periods, bleeding through a tampon and pad every couple of hours, and severe cramps that made it difficult to stand. Her abdomen was visibly swollen and firm, resembling pregnancy. She was unable to button her jeans. The doctor did not examine her and said, "Every woman dislikes having her period. Take an iron supplement and 5 or 6 ibuprofen for the pain." She sought a second opinion, and the new doctor immediately referred her to radiology. She was diagnosed with a grapefruit-sized fibroid tumor in her uterus. She underwent a hysterectomy at age 35. Story 2. A doctor asked what medications I was taking, and I told him. He asked why I was taking them, and I explained that I have bipolar disorder. He said, "Whoa, have you heard any kittens lately?" Story 3. Obstetrician gynecologist. Woman. I went to get a birth control prescription and a checkup, and she found symptoms of trichomoniasis. She said with utter vitriol, "We need to get this cleared up because I know what you all are like. If we don't treat it as soon as possible, you'll just spread it to dozens of innocent men." I was barely 19. I had only ever had one sexual partner. I had been a virgin a year before. This was my second obstetrician gynecologist visit, and I was lost and terrified. I am 36 now, and I still remember that exchange. Probably will for life because that was shocking, ma'am. Story 4. Switched doctors when COVID-19 happened. Went to my new doctor and told him about my torn Achilles tendon. He flat out told me I was lying. The previous office sent my file, and he saw the ultrasound of my torn Achilles tendon and changed his opinion. I went back to him a couple more times due to a lack of doctors, but he continued to make me feel like I was lying. I went to a therapist and he asked, "How long have you been struggling with depression?" I told him since I was a teenager, and he straight up said, "No, you haven't." I just walked out of his office. Story 5. I tried to talk about consistently awful and painful gastrointestinal problems I had been having. She held a finger in my face and said anxiety and refused any further action. Then she told me to lose weight because I was getting fat. I went to another doctor who was appalled and said yes, it could be caused by anxiety, but that does not mean you have to suffer, and we should make sure nothing else is going on. She did some tests, referred me to a gastroenterologist, and I was diagnosed with irritable bowel syndrome. I was put on appropriate medication and my quality of life dramatically improved. I think about that response sometimes. Could be anxiety, but that does not mean you have to suffer. Story 6. When I was in the mental hospital for self-harm, the doctor told me to have someone watch me do it to make sure I did not cut too deep like he did with his girlfriend. What? Story 7. I went to the doctor at age 16 about my heavy periods and severe cramps. I was told at the time that endometriosis does not exist and that it was just bad cramps, which is normal for girls my age. 16 years later, I am trying to have a baby and had an initial ultrasound at a fertility clinic. The ultrasound technician looked at my ovary and said, "Oh my God." She left the room, came back with another clinician, and told me I have an 8-centimeter cyst, larger than a peach, on my ovary. It was the biggest one she had ever seen, and I definitely have endometriosis. 1.5 years, countless blood draws, 1 magnetic resonance imaging scan showing stage 4 endometriosis lesions, 3 unsuccessful in vitro fertilization cycles, and 1 laparoscopic excision of my tubes and endometriosis tissue weighing 5 pounds, approximately 2.5 kilograms later, I will probably never be able to get pregnant using my own eggs. My body is severely damaged by this disease. If my doctor had believed me half my life ago when I first brought this to his attention, I might have been able to reduce some of this with medication, earlier surgeries, or fertility preservation when I was younger. I have been dreaming of being a mother since I was little, and this may never happen for me. It is devastating. Story 8. My psychologist had advised me to go to the emergency room for help if I ever felt like harming myself. So one day I did. The doctor on call sent his assistant to talk to me. She told me to go for a walk next time instead of using hospital resources. I told her that if I went for a walk in that state of mind, I would likely jump off the highway overpass. I understand that exercise is good for mental health, but that was not the kind of help I was expecting. Story 9. People do not get depressed at 13. It is just her period. Surprise. It was depression. Story 10. For something more funny, my father got COVID-19 last week, and I took him to urgent care to get some medicine. He does a nasal swab and the nurse removes it, normal procedure. The nurse practitioner comes in a few minutes later and asks my father, "Hey, how are you feeling?" "Tired." "Well, yeah, you have COVID-19. Wait, I probably should have said that a different way. Sorry, I have attention deficit hyperactivity disorder, and my medication wears off around lunchtime. I probably shouldn't be saying that. Sorry, when I'm unmedicated, I talk a lot. I need to stop talking about my attention deficit hyperactivity disorder. Anyway, we got a Paxlovid prescription and a great story. Thanks, Mr. Attention Deficit Hyperactivity Disorder Nurse Practitioner, you were great." Story 11. I was at a gynecologist, legs spread open in front of him. The doctor looked up at me and said, "You need a bit more exercise, don't you?" I was 15 and not overweight. Story 12. Not me, but I came across this person in my province when he was in the news for unprofessional behavior. Dr. Terrence Davids, who appears to be working in Saskatoon now, refused to refer a woman for an abortion while he was working in Humboldt, Saskatchewan. He tried to guilt-trip her by asking how she would feel about her deceased baby in heaven. He also refused to renew prescriptions for antidepressants and anxiety medications, telling people that they just need Jesus. He was working as a pastor in that city at the same time. Story 13. It is sad and not at all unexpected that most of these responses are from women. Doctors are notorious for not taking a woman's pain seriously and not doing anything until something life-threatening happens. If then, no apology either. Story 14. I have two examples from two different doctors. 1. I'm happy to see you lost weight. I bet you'll even be able to get a boyfriend now because it probably would have been hard for you before. Just make sure you keep it off. You want boys to be attracted to you, don't you? I was a 16-year-old girl with her then-boyfriend in the lobby. We had been together since before I lost weight. Not that it mattered. 2. Okay, let's hear about this anxiety of yours, he said, rolling his eyes. I was in my mid-20s and mentioned to him during a blood work appointment that I had been feeling anxious about my father's stage 4 cancer diagnosis and the start of chemotherapy. Doctors can be difficult. If you find a good one, stick with them as long as you can. Story 15. Attributing everything to my hormones when I had a broken bone. Story 16. I already posted this, but just remembered this story. I went to a dermatologist for hidradenitis suppurativa and wanted to discuss new skin issues related to the illness that had appeared on my breasts. I told her that my husband did not care, but it was really bothering me. She said, "Well, there are treatment options, but the one person who really matters does not care. So I would say let's just leave it." I never went back. I also never paid the bill for that appointment. No regrets. Story 17. Not to me, but about me to my mother. At 8 years old, I started my period. Obviously concerned about how young I was, my mother took me to the doctor who said, "Well, in some places, she is now old enough to marry." To me, "Have a child now before you start chemotherapy," which I was due to start a day or so later. Story 18. One time my doctor called me to tell me I had an incurable sexually transmitted disease, but he read the wrong patient information. Story 19. Nurse here. The doctor said to me, "Don't worry, he will forget all about it in the morning," after he slapped a demented elderly man across the face when the man was not being cooperative with an exam. This was reported to administration, who did nothing. Story 20. I'm sporty but couldn't do those sports any longer due to pain in my knees. He looked at my magnetic resonance imaging scans and said there was nothing. Women's knees sometimes hurt without a reason. It's even got a name. It's called the knee pain of young women. He then proceeded to tell me I should do more sports, that women's knees just hurt from doing nothing, fully ignoring that I came in for pain in my knees after or during sports. A year later, it has gotten worse. Another doctor and another magnetic resonance imaging later. I am waiting for surgery as what was a little lesion before has turned into a larger, scarred lesion. Yet, this is not nearly the worst thing doctors have said or done to me. I know for a fact that I have repressed a lot of terrible experiences over the years because I never wanted to think about them again. It is kind of buried there like a large meal in my belly that I just cannot bring up to recall. Story 21. Oh, I had one person accuse me of being a sex worker. They wouldn't believe me when I explained that he was wrong, and no, I was not. I think he wins first prize. Story 22. Not to me, but my mother. She was seeing the doctor about getting her tubes tied after having given birth to her third and final child. She held the infant in her arms, while 4-year-old me played with my dolls in the corner. The doctor heard what she wanted, looked at both me and my baby sister and said, "Well, what if one of your kids dies? You won't be able to have another." Story 23. You're just stressed. An otherwise healthy 19-year-old doesn't have gallbladder issues. 6 months of pain later, I refused to leave her office without further testing and a specialist. I was in surgery less than a week later, and they found my gallbladder had begun to fuse to my liver. I was in surgery for over 4 hours for what should have been a routine procedure. I spent the better part of a year in agony, unable to eat almost anything that wasn't lettuce or capsicum without feeling sick, just because she didn't want to order the tests, believing an 18-year-old can't possibly be sick. There are many other issues, but that one stands out. Story 24. My doctor has repeatedly told me I am too young to have arthritis. I am 28, despite it being genetic in my family and my grandfather being diagnosed at 25. They are refusing to refer me for tests and scans, so I have basically just got to live with the pain. Story 25. A psychiatrist told me, entirely unprompted and during our only meeting, that the reason I kept having boyfriends break up with me is because my voice is annoying. I talk fast when I am nervous, and obviously I was with that man. What a jerk. Story 26. I went to my doctor because I had a sinus infection that burst a blood vessel under my skin. My doctor thought I had been hit by my husband. After the x-ray, he realized I was correct. Then he had other medical staff come look at what he called their freak of the week. Story 27. I went to the doctor for a checkup. She asked me no questions about my diet and exercise habits and immediately began a lecture about how I needed to lose weight because once I had children, I was going to gain a lot of weight. She also did not ask if I wanted children. I was 17 years old. Story 28. The doctor told my mom that my vomiting and severe abdominal pain was colic. 3 days later, I had surgery to remove a ruptured appendix. This was after he called her neurotic. My general practitioner as an adult told me that the sudden change in my periods, from medium/light and fairly pain-free to very heavy and excruciatingly painful, was because of my weight. I have been overweight my entire adult life. It took threatening a formal complaint for her to refer me to a gynecologist, where it was discovered that I had several fibroids that needed removing. Story 29. Told my wife, "You have endometrial cancer, but it is the good cancer. You will get a hysterectomy and be done. Nobody ever dies from this cancer." She immediately had the hysterectomy but died a year later. Story 30. The gynecologist lectured me about how beautiful my body was and how removing the 5-centimeter cyst, which we didn't know if it was cancerous or not, would ruin my body. She said it would make me lose friends, cause me to be ostracized, and even change the music I listened to. She didn't listen to anything I had to say. Then she made me sign a waiver saying I didn't understand the surgery I was having. The gynecologist again commented on my body with the nurse before I was put under for my surgery. I was 19 or 20 years old. And yes, it was a woman. Story 31. As an 18-year-old, I experienced infrequent short episodes where I could not talk or understand language. I went to the doctor, and she accused me of being a drug addict, even though I never drank alcohol or did drugs. I was young and embarrassed to see a doctor again. Years later, after having a tonic-clonic seizure, I was diagnosed with epilepsy and a brain lesion that had bled, which I was previously unaware of. Story 32. Let's just pretend for a second that I am the one with the medical degree. I had spent the last 5 years trying to sort out my chronic period pain, nerve pain in my hands, constant dizziness, and went in because I had started having stabbing headaches that made me drop to the ground incapacitated for a few minutes at a time. I made the mistake of doing a basic internet search and saying that my symptoms aligned with a few disorders. I was just trying to help, after feeling like I was wasting all my previous doctor's time by seeming to be yet another woman with unexplainable chronic symptoms. Story 33. He told me my health issues made him question why he became a doctor. He wished I was in the emergency room for a broken leg instead of chronic bladder infections because I had a kidney transplant. He was very unpleasant. Story 34. I went to my doctor with some leg issues. I couldn't feel my right leg, and it took immense focus to use it. This was a recurring problem I had experienced almost exactly a year earlier. The last time, a temporary doctor at the clinic had basically told me to walk it off and come back in a week if it was still an issue or got worse. This time, a different doctor told me the same thing. Both times I went home, except the second time I showed up the day after with my grandmother because less than 24 hours later, I could not walk without assistance and was unable to get out of bed without help. There was some concern this time, but it was limited to "let's send you in for blood testing." The test center was closing for the day when we arrived, so my grandmother drove me straight to the hospital. I ended up being in the hospital for almost a month and was diagnosed with multiple sclerosis. I haven't had a temporary doctor since, and my private medical practitioner takes me very seriously. Story 35. Not sure if it counts, but when I was probably 12 or so, I was having gynecological concerns. The nurse asked how old I was when I got my first period, so I told her it happened when I was 8. That is the truth, and I was well aware that I started very young. She laughed and said, "Okay, how old were you really?" Story 36. The doctor said to me after lancing an abscess in a very sensitive area without warning or pain management, "In Pakistan, we do not have time for anesthesia." I am not in Pakistan. If I could have gotten a hold of him, I would be furious. Story 37. I was not there for it, but a doctor told my 36-week pregnant wife that just because she is pregnant does not mean she should forget about my sexual needs. No, I was not complaining about that. Yes, he was reported. Story 38. Chronic illnesses have made me a professional patient. I just got back from the emergency room today. Husband. Not me, for once. Doctors have told me to quit faking it and go back to class while I was throwing up, even after I had thrown up blood. I have been told to take a few Aleve and some stomach medication to cope with hip dislocations and bursitis. I often get dismissed. No one wants to take my pain or issues seriously because I am female and young, so they assume I am lying, seeking attention, or seeking drugs. Honestly, I take about 11 pills a day just to stay alive. I do not want to add more, but if it helps with any of my issues, fine, add it to the list. Story 39. Do you think about hurting yourself? Then she opens her drawer, pulls out a prescription bottle, and sets it down. 50 of these pills, and you will never wake up again. All of your problems will be over. She might think that I owe her a few picture frames from her office, but at this point, I just hope she is in hell. Story 40. I knew something was wrong with my body. I was experiencing various seemingly unrelated symptoms, so I started researching what could explain them all. I went to see my general practitioner and said, "These are my symptoms. I am pretty sure I have multiple sclerosis or some other autoimmune disease." This condescending doctor laughed at me and said, "Oh, nobody gets multiple sclerosis." A year and a half later, after visits to multiple specialists to treat individual symptoms, spending a lot of money, and undergoing painful therapies, I finally found another doctor who listened to me. I underwent a spinal tap. Guess what? I have multiple sclerosis. Because of the delay, I started my treatment later than I should have, causing unknown damage to my spinal cord. I will never forget that first doctor's response. Story 41. One of your wife's ovaries appeared suspicious for cancer, so I removed both ovaries along with the fallopian tubes. They were not cancerous. We sued, he settled, and we built a house with the money. Story 42. I attended the general practitioner with stomach pains. My mother was worried because appendicitis runs in her side of the family. He asked me if I was sure it was not just my period. When I told him I was in the middle of my cycle, so it could not be, he shrugged and said it was probably just cramps. 12 hours later, I was out of surgery and told my appendix was on the verge of bursting when they opened me up. Story 43. 9-year-old me went to the eye doctor because of poor eyesight. He told me my eyeballs were growing too fast and that there was a small probability they would grow so long that they could press against my brain and be life-threatening. What a monster. Story 44. Whatever that bleeding is, it is not from your rectum. In other words, you are either mistaken or fabricating it. Are you sure you do not have your menstrual period? Diagnosis of ulcerative colitis occurred 3 weeks later. Story 45. If you don't lose weight, you will be dead by the time you are 27. I was about 14 at the time, being told that my blood pressure was extremely high because of my weight. I was a 14-year-old with high blood pressure. I was never referred to a cardiologist, never saw a specialist or endocrinologist, nothing. It made me give up. Why should I care about anything? I'm going to be dead by 27 anyway. I genuinely didn't start living my life until my 27th birthday. Interestingly enough, I lost a significant amount of weight around that time, and even 100 pounds down, I still had high blood pressure. They completely ignored the fact that a 14-year-old child was presenting with high blood pressure, and no one did anything to find the root cause. They blamed me for overeating in a family with unhealthy habits, with parents who overate themselves, the pets and the kids, and dismissed me. I didn't get properly listened to until my late 30s, and I didn't have it properly controlled until then either. I resent the woman in particular who played a part in ruining my mental health. Story 46. Background. I am overweight. The story. My youngest was born with a severe tongue tie and lip tie. The lactation consultant was taking some personal time, so we did not realize what was happening until he was starving and I had bilateral mastitis. He fooled me. He looked like he was nursing. The latch felt good. Everything appeared perfect, but he was not transferring milk. Took months of work. Lasering the tongue tie, pumping constantly, cleaning all the pump equipment, taking every galactagogue available, bottle feeding, syringe feeding through a thin tube near the nipple. Everything. Finally, he figured it out and became a nursing champion after nearly failing to thrive. Then he became healthy and gained weight as babies should. I was at our family doctor's office, waiting with the door open for her to arrive, when another doctor from her practice walked by, recognized me, and asked how things were. I said, "Look how cute and chubby this baby is now. We are doing great." He looked me up and down and said, "Be careful not to overdo it now. As in, you are overweight, so do not feed your breastfed infant who is still 2 or 3 months away from eating solids, too much junk food." I knew he was out of line, and you really cannot overfeed breast milk. At the same time, I was devastated. Story 47. I asked about an autism evaluation, and my primary care provider laughed and said, "If you were autistic, you would not be able to participate in this conversation." I left. 2 years later, I was diagnosed with autism. About 2 years after that, I was diagnosed with Ehlers-Danlos syndrome and a long-standing cerebrospinal fluid leak. Her diagnosis had been anxiety and a headache. Story 48. A year ago, I went to a doctor's appointment for severe pain in the left side of my back, and I could hardly breathe. It got to the point where, when I would lie down at night, I was in tears from gasping for air. I went to the appointment and explained everything that was happening. The doctor insisted that it was a pulled or strained muscle and that it would go away, but I could go to the emergency room if I wanted to. I trusted my instincts and went to the emergency room. It turned out that I had blood clots in my lungs and that one part of my lung was starting to die. If I hadn't trusted my instincts and gone home as the doctor said, I could have died from that. Story 49. I was around 24 years old and asked my gynecologist about getting sterilized. She laughed and said, "We cannot do that. What if your future husband wants children?" Story 50. If you lost 50 pounds, all your problems would go away. I got very mad, but eventually, I lost 100 pounds, and let me tell you, all my problems did not go away. Story 51. All my life I felt different. I struggled with social interactions and had severe depression since I was a teenager. During the pandemic, I had to go to a mental hospital because my condition worsened significantly. They treated the depression, but something still felt off. When I returned to a mental health clinic for 8 hours per day, I told my therapist that I might be autistic because it would explain a lot. He refused, saying, "You can look me in the eye, you can't be autistic in any way. However, a few weeks ago, I was diagnosed with autism. Story 52. Not sure if this counts, but I have had a nurse say many inappropriate things to me. It is one of the reasons I married her. Story 53. When you decide to have children, after I had expressed on multiple occasions that I was not having children, it was not just a slip of the tongue. He is a traditional Mormon man and cannot understand a woman not wanting children, so he kept pushing it. Story 54. I don't think you are autistic. You just do not care about people. Thank you. If I did not care about people, why would I be asking to be considered for an autism test because I am worried that my reactions and perceptions with other people are hurting their feelings? Story 55. I had a terrible gynecologist at my very first exam. She explained nothing, and the speculum made me tear up because it hurt. She asked me if I had a boyfriend, and when I said no, she looked me straight in the eye during the exam and announced, "I think you have depression." Took years to get that removed from my file. Story 56. I went to the emergency room for a kidney stone. The doctor thought it was early labor pain. I told him that was impossible as I was a virgin and joked about being the next Messiah. He could not believe a woman in her early 20s was not sexually active and demanded I describe to him what I thought sex was. It was not even my first kidney stone, and he thought it was more likely that I was having sex without knowing it. Story 57. You need to lose 10 pounds. There is no way I would assess your fertility in your condition. My body mass index is high because I am muscular. I had 20% body fat and ran 4 miles every morning for warm-up. What the heck? Story 58. As aggressive as your cancer is, it has likely already spread, so you are looking at probably 5 years left. It had not spread. I am still here. Story 59. I had a problem with my hands going numb and awakening me at night. I was losing a lot of sleep, so I went to see a military doctor through military healthcare. I explained my symptoms, but he just looked at me and said nothing. After an uncomfortable pause, I asked, "Do you think it's a significant problem?" He looked at me and said, "Well, it's not a problem for me." Then he got up and told me to check out at the front desk on my way out. It was open season in my job, so I changed to commercial health insurance, saw a civilian doctor, and was diagnosed with severe sleep apnea. It was a life-threatening case of apnea, but he was right, it was not his problem. Story 60. You need to go to church when seeing him about panic attacks. Story 61. My psychiatrist told me there was nothing he could do to help me and that I would likely die. Edit. He said this as if he were ordering a coffee in the morning. He simply did not care at all. Story 62. It was not really unprofessional. It was just unwise. I went to the internist with severe tiredness. I used to be a rock climber who hiked for 12 hours without breaking a sweat. But now I cannot walk up the stairs. I have not had COVID-19 as far as I know, and all the blood tests were negative for known illnesses. This illness has lasted for 3 years, and I have gained a lot of weight during that time due to inactivity and depression. I spoke to the doctor about other solutions for my tiredness, and she gave me a card listing the types of fruit I should eat. She said I should avoid oranges and bananas but eat blueberries and mangoes. It was discouraging. My problem is not that I am eating the wrong fruits. My problem is that I suffer from severe tiredness. It feels like they cannot find the cause of the tiredness, so they start treating issues I did not ask for help with. Story 63. Do it until she screams in pain. The she refers to a literal just-turned toddler. No, I did not listen to them, and yes, I reported them to the medical board. Story 64. When I was about 25, I had a large ovarian cyst rupture. It was the worst pain I have ever felt in my life. I saw my primary care doctor, who told me she thought it was an ectopic pregnancy. She asked if I was married, and I said no. Her response was, "Well then, let's hope it's not pregnancy." That was totally uncalled for. I never saw her again after that. Story 65. For a few years, I lived in a very rural area, and there was only one doctor I could see. He definitely should never have gone into medicine, as he never correctly diagnosed me. The first time I went in was after experiencing cluster headaches for the first time. They had been ongoing for 11 days at that point, and I was in the middle of an attack during the appointment. which caused my eye to swell and have continuous tears flowing. He told me I was wrong because only men have cluster headaches and that they only happen in the autumn. He also insisted that I was having a regular migraine and berated me for not telling him about my history of migraines, despite it being clearly listed on my records. The next time I went in was for side pain and feeling so full that I couldn't eat. He told me that my side hurt from coughing so much, even though I hadn't been coughing at all, and that I had heartburn. It turned out I actually had a huge abdominal tumor. The truly unprofessional part, though, was the fact that he would mock me for having gray hair every time I saw him. Story 66. A doctor in the emergency room walked up to me after I had been there about an hour and, without any examination, handed me discharge papers and told me to follow up with my family doctor in a few days. I went to another hospital 40 miles away. They rushed me to the catheterization laboratory just in time. Widowmaker heart attack. Story 67. Every time I go to a new gynecologist, they look at me, then at my chart, and then at me again. But you are not overweight. I am aware. That does not change the fact that I have severe polycystic ovary syndrome. This happens every single time. Story 68. Your thick, long hair is causing your headaches. 5 years later, they found an arachnoid brain cyst. Story 69. It's unpleasant, but 2 separate obstetrician gynecologists said this. Green discharge is normal during pregnancy. And why do you think bacterial vaginosis can be treated during pregnancy? It cannot. Thank you, now I lost a child at 22 weeks due to your negligence. It has been 4 years this autumn, and I still have to pass one of the places daily to pick up my rainbow toddler from daycare. Story 70. I had a 6-week baby checkup for my first newborn. I said to the pediatrician that I was concerned because he throws up a lot. If anyone had told me how much a 6-week-old baby would or could throw up, I would have never believed them. The doctor responded, I don't do any baby feedings. My spouse does all that, so I can't answer your concern. Needless to say, he is no longer practicing as a pediatrician in Chandler, Arizona, as far as I know. The child is a healthy 25-year-old with still very bad reflux. Story 71. This was not said to me, but to someone I know who is severely overweight and has cholesterol issues. I am surprised you are still alive. Like what? That is not encouraging at all. Story 72. Many years ago, when I was first diagnosed with polycystic ovary syndrome and was struggling with my weight, I tried to get help from my obstetrician gynecologist. She gave me a Plexus pamphlet and tried to convince me Plexus would help fix my insulin resistance. The runner-up was the male emergency room nurse who called me a spoiled white girl when I was in the hospital after my first suicide attempt. I was 16 and in an abusive relationship with a man almost 10 years older than me. Another incident was when my gallbladder ruptured at 28 weeks pregnant, and the emergency room doctor told me it was my fault for being overweight and eating chips all day. I had lost 80 pounds before getting pregnant and was basically living off fruit and gelatin since those were the only foods not causing me constant gallbladder attacks. Story 73. I was giving birth to my first child. On my back in bed, feet in stirrups between contractions. He was at my feet sharing how coyotes ate his outdoor cat. I am a cat lover. It was terrible. Can this moment not be about this man's stories? Thank you. Story 74. My obstetrician gynecologist asked me if I had any sexually transmitted diseases, and when I answered no, he asked me if I wanted some. Creepy. Story 75. While giving birth for the first time, after 2.5 hours without the baby descending, I asked if I could try a different position. The male resident replied with an irritated tone and a grimace on his face. Fine, but only for a little while, and if it doesn't work, you will go back on your back again. I was too exhausted and shocked to respond. I wish I had stood up for myself. Story 76. He came in, flipped through some pages, and told me that I have lupus. I asked what that meant, and he said, well, you can look it up online. Why am I sitting in your office then? Story 77. I suffered from acne as a teenager and was also quite shy. Took a lot of courage to make an appointment to see the doctor. He suggested using sandpaper. This doctor was well known for being unpleasant in that practice and lived up to his reputation that day. Story 78. I was 19 years old. I went in for thrush. The doctor recommended that I stop all birth control because my fertility window was diminished from polycystic ovary syndrome. If I ever wanted children, I should start trying now. That was a decade ago. I am glad I did not do that. Story 79. He talked about me as if I was not even in the room, and he told me I was just insecure. Story 80. My female physical therapist asked if my fiancé approves of me having alternating nail polish colors. I still have yet to figure out what that has to do with a busted shoulder. Story 81. I had a plastic surgeon tell me I should sue the person who performed my rhinoplasty. I never had a rhinoplasty. Story 82. I was feeling dizzy at work and thought I might have something wrong with my ears. I went to the doctor and told him I was feeling dizzy. He said, "Yeah, all women are dizzy. What does that even mean?" It turns out I was having withdrawal symptoms from stopping an antidepressant suddenly. Another doctor had told me that was not possible. Story 83. I was 21, married, and pregnant. My husband was a member of the United States Marine Corps, so I saw a male military gynecologist. At my first pelvic exam, he was examining me and somehow pinched me. I jumped slightly in surprise and pain, and he looked up at me with disgust and said, "Oh, that didn't hurt." I thought, "How do you know?" After the appointment, when scheduling my next visit, I chose a different doctor. The doctor I chose was wonderful. Story 84. You have been coming to me for a long time. If you do not mind me saying, I have fallen in love with you. True story. Story 85. Late to the game, but I want to vent about this. Last year, I had to have a hysterectomy due to cervical cancer. I am all good now with no precancer cells. About 2 weeks after my surgery, I moved or stretched wrong and started experiencing repeated stabbing pain in my abdomen near one of my incisions. A friend took me to the emergency room, and the doctor insisted I had an ulcer even after I showed him my scars. Later, I told my oncologist about it. She said it was likely a muscle spasm and ordered tests to make sure it was nothing else. She apologized that they did not listen to me initially. It was not anything else, but a 4+ hour muscle spasm on a surgery scar is very painful. Story 86. When I spoke to my doctor about menopause symptoms and lack of libido, she said, "Sometimes women just have to do things they do not want to do." Story 87. The doctor was annoyed. I couldn't hear him because he wore a face mask. I am deaf in one ear and have severe hearing impairment in the other ear. I told the receptionist when I scheduled the appointment about my hearing impairment. I also mentioned it to the medical assistant who checked my vital signs. The doctor walked out and came back with the receptionist. Then said, "Can you hear me now?" He still had the face mask on. The receptionist asked me to get a hearing aid and come back to reschedule my appointment. I told them both, "I do have a hearing aid in. It is hard for me to understand words with a face mask on because I am a lip reader." It was very uncomfortable there. I have never experienced that at a doctor's office before. Story 88. I was 17 and going in for attention deficit disorder evaluation. My family all has it. She said, "I'm sure you have it, but I'm not going to prescribe you the medication because you will just sell it." Story 89. I was suffering from postpartum depression and my general practitioner told me I should just get more sunshine. Story 90. My wife gave birth and had a small tear as a result. The doctor was putting in a few stitches and asked me how tight I wanted her. Story 91. I went to urgent care with acute onset burning in my chest. The doctor had a picture of Clint Eastwood taped to his identification badge. He told me, "You are female, overweight, 40 years old, and probably flatulent. It is your gallbladder." I was totally appalled but just wanted relief. Shortness of breath was correct. Story 92. I wanted to meet the gynecologist who helped my mother give birth to me. He lectured me on my posture, dehydration, sleep cycle, and fat, then asked how old I was. I said 21. He said, "Bloody hell, you look 30. If this continues, you'll look like your mother's younger brother." I understand the importance of being fit and healthy, but the choice of words could have been much better. Story 93. I had my tonsils and adenoids removed when I was 6. When I was 22, I noticed a large lump on my neck along with fever and chills. I also developed a rash. My mother thought I had mononucleosis because of the symptoms, but I could not have the telltale splotches on my tonsils because they had been removed. I went to the doctor and shared my mother's suspicion, adding that I avoided checking WebMD because it often suggests cancer. I laughed nervously because I felt uncomfortable being sick without knowing the cause. The doctor responded, "Well, you are at the prime age for non-Hodgkin lymphoma." This was on a Friday afternoon appointment, so I had to wait all weekend for the blood test results, which the doctor initially misread and tried to diagnose as Lyme disease. It turned out to be mononucleosis. Story 94. I hurt my back. I spent 2 days virtually paralyzed in bed with excruciating pain, taking over-the-counter pain relievers. Nothing relieved the pain. My husband had to fashion a bedpan to help me urinate. On the 3rd day, my husband called emergency services to get me to the hospital. Our hallway was too narrow, so they had to strap me to a backboard and turn it sideways to get me out of the house. I am normally very pain tolerant and a quiet sufferer. I went from whimpering to shrieking with pain. I was transported flat on my back, strapped down, with no way to draw my legs up to relieve my back. The ride to the emergency room was so intolerable I passed out at one point. At the hospital, I begged to be unstrapped. I admit to being pretty unhinged by the time the doctor came in to see me. I tried to explain what caused the injury through tears, snot, waves of pain, and nausea. He looked at the nurse and said, "Redheads are such drama queens. She obviously wants drugs. Get her out of my emergency room." I was sent for an MRI and diagnosed with 3 slipped discs and other damage. Story 95. When I was in my 20s, my parents came and got me from college and took me to our family doctor in a small Alabama town because I was anorexic and weighed 82 pounds at 6 feet 1 inch. Finally, I admitted I needed help, and that is where we started. He asked me if I was gay, tested me for human immunodeficiency virus despite me saying I was not sexually active and had lost all of my libido, and asked if he could say a prayer for me. When I left the room and told my parents, we changed doctors the next day. Story 96. I was told I would grow out of my eye condition. I was 28 at the time. Story 97. Not said but done. I went in with a cough. He had me take off all my clothes and stand naked while he examined both breasts. He placed the stethoscope on my back and front to check my breathing. I was 14. Story 98. So it says here you are bipolar. Yeah, you look like you are bipolar. I asked for clarification, and he replied that I have certain facial features that indicate the condition. I was fine with that until he mentioned my hair. I never went back to him after the initial visit. I felt insulted. Story 99. I was in for a cervical biopsy without anesthetics due to a positive human papillomavirus result, for which I was told it was caused by being promiscuous and not using a condom. When I removed my legs from the stirrups and cried in pain, a nurse looked at the bruising on my leg from a previous fall in the bath and asked, "Oh, a drunken night out fall, was it?" Story 100. 3 years ago, I went to my doctor, complaining of pain in my left thigh. She said I probably pulled a muscle. I saw her every month for the next 3 months, complaining of the same issue. She dismissed my concerns. 2 weeks later, I was walking into the den and fell to the floor. I thought I had tripped over a chair mat. I wouldn't let my husband touch me or roll me onto my back because my leg had started to hurt. After 45 minutes of not moving, we called emergency medical services. You cannot refuse their assistance, so they rolled me over. Turned out it was not a pulled muscle. My femur had developed a crack and finally broke through. After 2 surgeries and several cortisone injections, I walk with a cane and take pain medication to help cope. We probably could have sued but did not. I will be walking with a cane for the rest of my life. Story 101. It seems we accidentally injured your nerves. I was diagnosed with stage 3 cancer on my foot. They removed the tumor and lymph nodes, and afterwards I was in so much pain. The surgeon kept telling me it was the end stage, and I shouldn't be in pain. I became suicidal, and after years I was finally referred for a second opinion. The second doctor looked at the report and said, It seems we accidentally injured your nerves. That explains the pain. You can sue the doctor within 2 years of surgery. They kept making me think I was crazy for 2 years. Story 102. Are you sexually active? Yes. Okay. What is your gender identity? Male. Ugh, you are part of the problem. I was getting a sexually transmitted infection screening. Fortunately, the male phlebotomist was totally commiserating with me about it. Story 103. During a yearly skin cancer test, the dermatologist said you would be a perfect candidate for botulinum toxin. Story 104. A very long story short, my dad had brain surgery to relieve a subdural hematoma. He never really came out of the surgery, and after 4 days, I decided it was time to place him in hospice and let him pass peacefully. The neurosurgeon asked me why he even bothered doing the surgery if we were just going to let him die. The neurosurgeon wanted to place a feeding tube and put him in a care center indefinitely. I told him my dad would rather be dead than have that happen to him. Story 105. One gave me a hernia exam without wearing gloves. Does that count? Story 106. In my early 20s, I had a lot of trouble sleeping, which led to auditory hallucinations. I would freak out and go to the psychiatric emergency room. It was all very brief. They would make sure I wasn't a threat to myself or anyone else, then prescribe me medication that would make me nearly functional and allow me to sleep for more than 24 hours. One time, a doctor, the first time he saw me, asked the same old questions and directly informed me that I was schizophrenic. He started medicating me for it. He thought it was a good idea for me to have an exam, I believe an MRI. For days, I panicked, fully believing I was schizophrenic. Then the results came back, and the doctor said, "Oh, I guess not. My mistake. I never went there again." Story 107. I work in healthcare. A doctor asked me to strip naked and then asked how much money I make in front of the nurse. It was very awkward, but I responded by asking how much he makes. Then I would tell him how much I make. He did not respond. Story 108. The most unprofessional thing a doctor has said is, "It's just a pulled muscle." My daughter went back a day later, and we found out she had broken her first cervical vertebra. Story 109. There was no need to be so dramatic. This was said while the doctor was giving me stitches after I had just delivered my first baby. I was in labor for 30 hours and pushed for almost 4 hours because the baby was in the wrong position. I should have had a cesarean section considering how long I had been pushing without progress and the baby's heart rate kept dropping during contractions. But the doctor did not want to perform surgery in the middle of the night. Story 110. One time, I was in a doctor's office waiting for 45 minutes. The doctor came in and told me the usual information about how my levels are all normal, even though I still feel terrible and have for years, no matter what the family doctor guesses is wrong with me. I started to explain that I have been experiencing a strange pain on my leg but every 6 to 8 months without fail. Feels like a sunburn on the skin, but there is no redness or rash and it looks completely normal. He simply said, that does sound strange. Well, you know where the door is," and then walked out of the room. I have seen 5 doctors, and at this point, I can describe my symptoms perfectly, yet none have been able to help me. I trust the emergency room to conduct a more thorough investigation than a doctor I have visited many times. At least the emergency room did more testing than just my blood work. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.